Welcome back and thank you for keeping it NTV. You are still watching NTV Weekend Edition. Tonight, on Talk of the Nation, we talk climate change, where researchers and health experts are calling for more action to prevent adverse effects that the climate change has on the health sector. Now, this follows a launch of the National Health Action Plan for 2025 to 2030 by the Ministry of Health and various stakeholders. Now, this comes on the back of a study that showed that several health facilities are vulnerable to shocks like storms, flooding, and drought. Now, to share more with us tonight, we are joined by Dr. Herbert Nabaasa, the Commissioner in the Department of Environmental Health in the Ministry of Health. Good evening, Doctor, and thank you
Good
for
evening,
joining us.
Mildred.
It's good to have
see
you.
Good to see you.
All right, Doctor. So, getting straight into the conversation, when some people hear about climate change, what comes to their mind is issues to do with strictly the environment, and also perhaps something that does not have an effect on the human nature or human beings. So we'd like to understand, how does climate change affect the health sector?
Thank you, Mildred. And indeed, that's very true, that until recent, many people thought that climate change is a foreign issue. It's a global issue probably and doesn't affect us. Until recent, when we begin to realize a lot of changes in climate, a lot of changes in temperature, a lot of changes in weather, especially the rain pattern, where you expect to rain and it doesn't come, when you actually don't expect it and it comes in large quantities, and then you end up having a lot of effects, including the flooding, but also having unprecedented droughts impacting on the people. So yes, all this happens. Now people do appreciate it. They understand that it's no longer something that is very, very far. It's actually here to be with us. But I think the linkage between health and environment is a new thing. Before then, the whole world was looking at climate change as something to do with the environment. The linkage between climate change and people wasn't really well pronounced. It's until recent that, especially during Glasgow, COP26, when actually the world gathered to make commitments to address climate change impacts on health. And of course, Uganda made commitments, among others, to address impacts of climate change on health.
And what were some of these commitments that you
So
did?
some of the commitments, first of all, was to understand how it impacts on the health system. So one of the ways to understand that was to develop what we call a vulnerability adaptation assessment. So in Uganda, we have already done that. So we did our first ever vulnerability adaptation assessment to understand the vulnerability of the health system itself, ranging from the system to people. So now we have the findings, which we did in partnership with Makerere University, with support from Rockefeller Foundation. So we have understood now the implication of climate change on the health system.
Okay.
We know what it is on people. We know what it is on the health infrastructure. We know what it is in terms of the way of life. Okay. So arising out of the study, we now went into developing the HNAP, what we call a climate change health national adaptation plan. What was one of the commitments under the COP26.
Now, you've talked about that report and the study that you conducted with Makerere University. It also shows that out of over 700 health facilities across the country, 48% of these struggle with drought. 40% are exposed to floods and 31% to storms.
Correct.
Why do you think it's so?
It is so because we have scenarios that are very apparent. When we look around the country, from the Elgon sub-region to Rwenzori sub-region to Kigezi sub-region, even to the central region here, we have seen unprecedented impact from climate change. We have seen, for instance, in Kigezi, where we have seen landslides happening. We have seen in the Rwenzori sub-region, where we have seen the flooding affecting Kasese, Kirembe Mines Hospital coming down entirely. The whole hospital was washed down. And that was as a result of the landslides and eventually flooding coming down into the town and also affecting the health facility.
Okay. So how can we ensure that some of these issues are addressed? The extensive effects of climate change do not trickle down to the health sector. So
indeed, the effects of climate change are long-term. They are long-term, so they have immediate solutions. They have mid-term or medium-term solutions, but also they have long-term solutions. The immediate term, for instance, when you look at the health system, is to look at developing what we call a resilient health system. For instance, why do you have to locate a hospital in a low-lying area where you know that it's a flood-prone area and it can eventually be washed down. So locating the hospitals is one other factor. But also in the hospital itself, how do you ensure that you build a system that is resilient to the climate change? We've talked about drought, for instance. So drought comes with water stress, and yet the hospitals require sufficient amounts of water to avoid infections in the hospital. So to ensure that hospitals have access to safe water is one mitigation measure that we can have in place.
Okay.
But also ensuring that we have issues like safe energy or sufficient energy that is more reliable, but also more sustainable and more environmental sound. So we are moving into solarizing many of our facilities because solar is one of the sustainable energy solutions. Then having a resilient health workforce, people who understand how to plan, prioritize, and budget for environmental interventions in their budgets. We no longer want to see budgets in the hospitals that are just talking about just treatment. We'd like to see a holistic process in a hospital planning and budgeting process, whereby environment and climate change are part and parcel of the planning and prioritization of our budgets in the hospital budgets.
Okay.
Yes.
So you did mention an national action plan to build a climate resilient health system.
Yes.
And talk to us. Before we came on air, you did say that this is something that the Ministry of Health is partnering still with Makerere University. And talk to us about the implementation of this. When do we hope for it to kickstart?
So in order to address the impacts of climate change on health, the only way to do it was to respond to the global commitments that we made. And one of the global commitments that we made to address climate change impacts on health was develop what we call a climate change health national adaptation plan. So we launched that plan yesterday. So the plan has 10 pillars. Maybe if I can just underscore a few of those pillars. One of the pillars is to have proper leadership and governance for climate change. And that requires that we have leaders who understand the context, who are able to prioritize it in terms of planning and also budgeting and financing it, but also who are able to, to provide leadership at all levels of health service delivery. Number two, it looks at developing a resilient health workforce, a workforce that understands the climate change impacts. Somebody who is in a hospital as a doctor does not only have to occupy their work environment only with treating people, because you can treat people the following day. Climate change impacts on them directly, either through flooding or through lack of access to safe water, poor sanitation services.
Should know how to go about this.
Yes, so the workforce, once they are very aware in terms of the mindset change, they are able to address climate change impacts as part and parcel of their work. But also the other intervention is to look at preparedness. Have preparedness in place, and you are able to respond to the outbreaks. For instance, we've been grappling with a lot of outbreaks, including cholera. Cholera is one of the impacts, for instance, of climate change. When you have flooding, you have latrines or toilet facilities that are washed down, eventually water gets contaminated because of the fecal matter that comes into it. So if you're not prepared to have a system that prepares in terms of addressing such impacts of climate change, you'll have more exacerbated health effects and eventually death.
Okay.
Yes.
So what you've highlighted clearly indicates that we need, to pay attention to the climate change, especially on the health sector.
Exactly.
And why is it very important? Why should the person out there watching us or the layman deem it or see it as important to address the issues of climate change for the health sector?
It is important. For instance, when you look at the disease burden, we are talking about flooding, but the flooding itself, it translates into disease. Because when you have let's say, latrines being washed down, you have water being contaminated, and people would now have cholera or dysentery or other forms of diseases that are water related. Once you have disease, obviously, you have implications on a lot of things, socio-economic way of life. People who are supposed to be using money for education, for instance, are going to use that money for treatment. Hospitals. The money that is going to be used, should be used for other meaningful developments, is going to be now used into caring for yourself. When you have all this infrastructure being washed down, for instance, a whole hospital coming down, it means the government is going to divert money that should have been used into other meaningful infrastructure like roads or constructing new facilities, into repressing these facilities that have been washed down. If we look at Elgon, for instance, where we had a lot of landslides happening due to climate change, we had a lot of climate migration. People had to move away, and others had to be buried down, and they died. And so all these impacts boil down to health, people being killed, or lack of productivity. When you have droughts, you have issues of malnutrition because of lack of food due to stress, water stress. You have prolonged droughts. People now can no longer predict when they need to grow food. So as a result, you have shortage of food, and it eventually affects the availability of food in some areas. For instance, Karamoja. So once you have malnutrition, you have really a lot of challenges in terms of education. Children cannot go to school because they don't have food. Homes cannot be, productive because, to work, you need energy, you need enough food so that you are more productive. So the linkage between climate change and health is real. So it affects not only individuals, but also the state itself, because the state has going to come in and divert resources into addressing the climate change impacts.
Okay, so as we get to summarize this conversation, the School of Public Health has called for a multi-sectoral collaboration and approach to this issue of climate change, especially on the health sector. How will this work?
And indeed, of course, addressing the issues of climate change requires multi-sectoral effort, because it cannot be single-handedly managed by the Ministry of Health or Ministry of Water and Environment or Ministry of Education, because it's a cross-sectoral responsibility, and it starts from individuals. Individuals have to have that level of awareness that, first of all, allows them to do the right things. When you look at malaria, for instance, to reduce the malaria burden, you have got to do a lot of environmental cleaning or awareness to avoid stagnant water, to avoid the bushes around the home. So from an individual point of view, to the whole community point of view, to government stakeholders, to development partners, to academia, to media houses like you, it requires that everybody has to come in so that we pray a coordinated mechanism to address climate change, because it affects us, but requires a lot of coordinated effort and a multi-sectoral approach.
Okay.
Yes.
So, Doctor, what would be your last words?
My last word is that climate change has come. It's a reality. We can no longer shy away from it. It is evident from flooding, from prolonged droughts, because we can no longer predict rains. It's evident from the disease outbreaks. We see many of the diseases that are happening, especially the recent outbreaks of Ebola. All these are diseases connected to the environment. So it requires that the country is more prepared, individuals are more prepared, but more so, we come together to join hands to be able to address effects of climate change. Okay. And now that we have a plan, a health national adaptation plan, we require that government prioritizes it and finances it, so that we are able to address the areas that have been planned and prioritize it to reduce the impacts of climate change.
Thank you. You heard the doctor. Climate change is a responsibility for all of us, you and I, as well as the state, as he has clearly explained. Now, that conversation takes us in for a short break. When we return, NTV Weekend Edition continues shortly.